Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow, with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on the podcast are in no way any institutions, organizations, or guidelines, but only an individual's. For our session today, we have Dr. Laurie Matt Amaral. She is a medical oncologist and chairs the Department of Internal Medicine at Cleveland Clinic Akron General. She also serves on the IMG Community of Practice with ASCO as the president and soon-to-be vice president of Community Oncology. She is the vice chief of staff at CCF Akron General. She has 2 wonderful daughters and loves to read horror and thriller books. She likes to hang out by the beach and loves to shop. Dr. Amaral, welcome and thank you for being here.
Thanks for having me.
Wonderful. Thank you. And tell us about your practice.
So I am in a community oncology-based practice. I am affiliated with Cleveland Clinic Akron General as the hospital, but we are a community-based practice. So we see all types of hematologic and medical oncology issues, and we see all things.
Wonderful. So is it, it's more like, it sounds like all the academic institutions are trying to partner with their community practices in the health system. Is it that kind of a model that for the acute lukes, you can send them to Cleveland Clinic, or the sarcomas, you can send them to Cleveland Clinic, and the rest, the bread and butter, you follow up in the community?
So we can do any of the above. So typically we don't do the acute leukemic inductions here at Akron General. Typically those are up to main campus. So we have a very good lifeline to Cleveland Clinic main campus in Cleveland. If there's any condition that we're not sure of, any condition that we want to send to them, we have great partnerships with all the different divisions. So from an academic side, yes. Otherwise, we take care of all of, I would say, the mainstay of all the cancers here. I do actually treat a lot of sarcomas where I trained as a fellow. I had a lot of experience with an orthopedic oncologist. So we actually can see all things. If there's anything from an oncologist perspective that we're not comfortable with, we do have that lifeline up north for us, which is an awesome resource. But yeah, we are a true traditional, we do all things community-based practice, which is great.
Wonderful, wonderful. Dr. Amaral, you are mom of 2 daughters, and you're a full-time oncologist, and you have several leadership roles. How do you navigate this work-life balance and your life in general?
Oh, man, that's a tough one. I would love to say I have it perfect, but I'm nowhere near perfect. So I always attribute it to time management. I would classify myself as the classic type A, have everything planned. I can handle emergencies, but I have a backup to the backup to the backup sometimes. And when everyone really says that it truly takes a village, I would be honest, to be a physician and to have kids, it truly takes that village. We have a wonderful daycare and school system that provides like before and after school activities for my kids. So I am that mom that will drop them off at that before school stuff and pick them up at the end of the day. But then try to just balance what I do at work and try to leave it at work. You know, there are some days you just can't help it. You're working and you're bringing that work home. But at the same time, trying to make sure the kids know that you're there and you're around and you're participating with them. And it can be a delicate balance. You know, I have a partner, my husband, who helps immensely with that. So we share the childcare drop off and pickup. So I'm not the only person showing up at the kids' school. So I know what my husband looks like too, which is helpful. But yeah, it just takes that. Everybody asks how I do it, and I have not figured out the best answer to tell everybody, like, oh, this is how we make this happen. But it just juggle and figure out who's going to be where and make sure one parent's got something covered.
Right. Now, you actually bring up so many wonderful points. It may look perfect on the outside, but the person who is actually managing it from the inside, to them, it may not look perfect, and that's okay.
Totally.
Two, you have to have that village and plan B and plan C and plan D in case something falls apart, right? For
Right.
running work and family with kids. And then C, just to try and focus on doing work at work and family life with the family in the evenings, and let the kids know that you are there and present with them and engaging with them. And I think those are all some beautiful points. Thank you. Thanks
Yeah.
for sharing.
Thanks. Yeah, of course.
Laurie, you have several leadership roles at your workplace, and we talk about gender bias a lot in our oncology community these days, in the leadership programs these days. How has your being a leader been for you? Any experiences, good or bad?
Yeah, I actually have both. So it's a really good question. I have been where I'm at currently for more than 10 years. I trained
Mm-hmm.
here as a resident. So I'm
Mm-hmm.
really familiar with the area, the surrounding, the colleagues that I now call colleagues.
Mm-hmm.
Um, and so I think that's been helpful
Mm-hmm.
because when there are other, I don't want to say promotions, but places to advance your career, I have a name base, which has been very helpful for me. At the same time, though, I will tell you, I've been passed up for positions in leadership. You know, you hate to say it, but sometimes it's an all boys club. And I really love the fact that where I currently am at,
Mm-hmm.
they have done a great job at advancing female physicians into roles of leadership.
Okay.
It's been very inspiring.
Mm-hmm.
We had a CMO that was a female.
Mm-hmm.
She's now the president of our hospital, which is
Mm-hmm.
awesome and fantastic. I don't think
Mm-hmm.
there's ever been a woman in that position here.
Mm-hmm.
Um, a lot of the chairs of the departments, I serve as one of the chairs, and I'm chair of medicine, as you mentioned. That's never had a female in that position until I took it over a couple of years ago. So there are now other females on this, I would say, wall of excellence from a chair's perspective that never had a seat at the table. And so I think there's a lot of really great women who have a lot of really great characteristics,
Mm-hmm.
and they're finally being recognized, and definitely more throughout the country. My institution is not the only one that is
Yeah.
recognizing that.
Mm-hmm.
And I think the gender bias is finally, at least in little bits, if
Mm-hmm.
nothing else, starting to go away. And I think it's amazing. I've been around long enough that I've been passed up for other jobs because I've been quote unquote don't qualify
Mm-hmm.
when I have the qualifications. And
Mm-hmm.
so this was a huge step, being asked to be the chair of medicine after the person who was, doing it ahead of me left a great legacy. And he was an amazing physician, still is, he still practices. Um, but it's just, being offered that job, I was like, finally, like there's a girl in the seat. So it was just great. And it was inspiring at the same time because you finally feel like you finally feel like someone's actually going to trust you with that job. And it's a good boost of confidence. I am not going to lie.
Wonderful. Tell us a little bit about your predecessor, Laurie. Like how did your male predecessor help you come into that role and, of course, supported you to get into that role?
I got passed up for a few prior to that role. And so
Mm-hmm.
I ended up kind of coming in, I'll use the pun, under his wing, for lack of a
Mm-hmm.
better description,
Mm-hmm.
where he asked me to be the vice chair.
Mm-hmm.
So I was his backup to the job. So if there was anything that he couldn't do, any way that he couldn't make a meeting, I stepped in his place. And so that allowed me to be a little bit more involved in administration where I may not have had that input in the beginning, got invited to some meetings that I would not have been in otherwise. And that kind of just set the role for when he opted to move to a different institution, that I was the natural successor for the role. So that was a very, very big help.
Wonderful. Well, again, several great points there, because sometimes when we are, climbing the rungs of the ladder, it doesn't have to start at the top. We kind of like,
Right.
step-by-step approaches is something that is actually more helpful in the long run. Laurie, we talked about friends at work and friends at, outside of the work. How important is it for us to find our people at work, our colleagues, our friends? How important are those friendships?
Yeah, you have to have your people.
Mhm.
I mean, I have friends from college and
Mhm.
back home. I
Mhm.
live in a different state than most of my friends and my family. So
Mhm.
if that gives perspective to people.
Right.
So I don't really have a village when I moved here.
Okay.
I have no family village. I had no friend village.
Mhm.
And you know, I train with some of the same people that I trained with when I was a resident. So I have those friendships. They have been invaluable. You can call those people anytime and go, "Oh my God, did you know so and so did this and this was terrible and this is what's happening to me?" And I don't have to explain the medical part behind it because they're in medicine, right? Maybe a difference of specialty, but they
Mhm.
get what I'm saying with
Right.
whatever's bugging me for the day.
Mhm.
But also at the same time, they give me an outlet from a friend perspective. So some of the
Mhm.
residents I trained with are now
Mhm.
attendings and they're my colleagues here.
Mhm.
And we hang out after hours. My kids go to the same school that some of their kids go to school. So we
Mhm.
see them, I'll see the parents at Latchkey, which is outside of the work environment. And my kids will go to their kids' birthday parties and vice versa. So it's really good, I think, on both parts, because not only can I have friends from that perspective, but they also have a friend in me too. And so it's kind of reciprocal. I think with my kids being in school now, I found a village outside of work too, which is very helpful because, again, like I said, my family and friends are all out of state. So, as much as I would love to hang out with some of my best friends, some of them are only a phone call away, but they live in, halfway across the United States. So,
Mhm.
visiting them is not
Right.
um, a thing I do all the time.
Right.
um,
Can't do that on a daily
no.
basis.
Right,
Right.
exactly. I mean, we can pick up the phone and I can be left off, where we were 6 months ago when I last spoke
Right.
to them, but it's not the
No.
same as finding that crew locally.
Mhm.
So yeah, I just think it's helpful. And then
Mhm.
to have a crew of people that are related to, my kids being in school.
Mhm.
Um, I found some great babysitters that way. I've
No.
also just kind of gotten that mom side of things too. So you feel like a normal human being rather than this professional machine, if that makes
Yeah,
sense.
this is great because I feel like sometimes when I have not had a chat with a friend or a colleague for a little while, just because everybody's so busy, and then we have this meeting and everybody's sharing the same frustrations and disappointments as you have been kind of brewing in your heart for the last several weeks. I think it's almost
Right.
therapeutic to hear everybody
Right.
else's perspective, right? So it's very
Right.
helpful.
You hear someone else complaining about the exact same thing that you're
Right.
complaining about, and they're like, they get it. And you
Hmm.
didn't have to explain why they get it.
Right. Right. No, that's almost therapeutic, right?
Yeah, no, totally.
And I feel like in medicine, it's like it almost like it's like we have to become intentional of finding these friends and these colleagues because when you're a resident or a fellow, it's a very natural flow of things that, we rotate with all those friends and through the rotations, etc. And so we're like, it's natural that we have all those relationships around us. But when we are doing our own clinics or our practices or research or whatever our job might be, I think we have to be a little bit extra intentional to go above and beyond to find and maintain those relationships.
Yeah, it takes a lot of work. I'm not going to lie. That's
Mm-hmm.
one thing that I wish was not as difficult, but
Mm-hmm.
at the same time, it's
Right.
kind of where we're stuck.
Right. 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 But it pays in the end, so it's worth
It
the
does.
effort. Yeah.
Totally.
So, what would be one piece of advice, Laurie, that you would give to yourself of 10 years ago?
Ooh, that's tough. Um, I would say keep doing what you're doing. Um, you know, I, there are times when I wasn't sure, was I going to get a spot? Was I going to get into medicine? Was I going to be able to do the things I wanted to do? Would I match in my fellowship or subspecialty? There's definitely been those days. And I think I'm a big believer, and I tell my patients this too, I'm a big believer that everything happens for a reason. And I would, just keep doing what you're doing. Like everything that I thought I wasn't going to persevere with has done swimmingly well. I think that's my best advice.
Wonderful. Thank you. So a bit of a rapid fire, Laurie. What's your favorite book?
I am lately stuck on Frida McFadden. I am stuck on her. Yeah.
Okay.
I don't have a favorite of hers, but I have read a couple of her books, and I got to the end and went, "Are you serious? That's really what happened?" So I've been a fan of hers lately.
So are they like thrillers, murder mysteries?
They're more like a horror type twist of events. Some twisted plots. I mean, A for effort for her, because they're amazing.
Yeah. Wonderful. Your favorite leader?
I don't know. I mean, I'm, as a girl, I got to go girl power. I'm really into, Michelle Obama's an amazing human being. I don't know that I think I would consider her a leader in multiple levels. I guess it depends on what you're looking for. But yeah, I'm a big fan of Michelle Obama, former Vice President Harris, just a fan of just the things that they've been able to accomplish, let alone they're stylish. So that's a plus for me. So,
right. Your favorite study, any cancer study?
Ooh, that's a tough one too. I mean, I have to say some of the recent studies as far as like hepatocellular carcinoma have been done, just approving recent drugs with immunotherapy combinations, VEGFs. Those studies, we have not had really good success for some of those patients, except for those oral medications. I would think those are some of the tops. And then, of course, I love the new advancements with small cell. That's a crappy disease too. And we have not had any advancement. So anything to do with those two, I don't know that I could pick a favorite though.
Wonderful. Your favorite restaurant in your town?
I am a big fan of this one local restaurant. It's called Time Squared, or Time 2 is how it's listed on the internet, but it's Time Squared. And it's just the chef and the owner is such a down-to-earth guy, is local. It's not a chain. You can't go anywhere else to get it. And I'm a big fan of supporting the community to which I live. And they just have really awesome food. And the staff there is just awesome. So that would be my favorite so far.
And your favorite beach in the world?
Man, I've been to some amazing beaches. I love Antigua's beach. It's just so crystal and fantastic. But
where's that?
It's Antigua.
Okay.
In the Caribbean. I mean, there's some pretty beaches. Listen, anything that's blue water and clean white crystal sand, bring it on. But yeah. I don't know. I've spent a lot of time in the Caribbean just with school and stuff. So I'm a big fan of Caribbean beaches these days.
Wonderful. We'll talk about that in just a minute. So this is the fun fact about you that we wanted to talk about. Sure. You are an international medical graduate. Tell us about this journey, and how was your experience, and how is your experience now when people find out about it?
Yeah, so it's a weird thing. Nobody knows that for some reason, despite the fact that I have an ECFMG certificate, just like a normal IMG. I had to jump through all the hoops. They're like, wait a second, you're born in Michigan. Yeah. I was raised in the States. They're like, what do you mean you're an IMG? Yeah, I, along with a couple of my friends from undergrad, at the time that we applied, medical school was 0 spots and millions of applicants. And so we all wanted to go to med school, and we made it happen by going to a Caribbean medical school. That's what we chose to do. We knew there was going to be some extra hoops about it. And we did the hoops. My other friends are family practice physicians. We've all graduated successfully, done all the extra hoops we were supposed to do. But yeah, I think it's an interesting fact. Hardly anybody knows that about me. But when they read my resume, I kind of get that like, you're an IMG, huh? Yeah. And then and it's like not another thought after that. So I would say at first it was a big, back in the day, it was a big taboo. Nobody wanted to be the IMG when you're applying for residency spots or fellowship because it was taboo at that point. So I'm kind of dating myself, but it was a thing. So you had to like go extra far to prove yourself. So I think in the beginning, if you'd asked me 20 years ago, 15 years ago, when I started everything, I would have told you it's terrible. Just because of the taboos that went with it and the stigmata that came with it. Now nobody cares. It's not a thing. It's an interesting tidbit and a fact, but it has not affected me professionally in the sense that I've been not given a job opportunity or I haven't been given a leadership opportunity because I am an IMG. I suppose I could see how it could at some juncture if someone is still kind of, I'll say, set in their ways from previous, but has done absolutely nothing to affect me these days, now that I'm kind of in a spot and have a job.
Right. So was there a certain island which caters to a lot of U.S. kids for medical education that you went to?
Well, so I was on St. Eustatius, which is between St. Martin or near St. Martin and St. Kitts. So there was a school on St. Kitts, I believe. There was a school on Grenada. There was a school still on St. Eustatius, or Statia is what it was known to the locals as. And I think a lot of the Caribbean schools did cater to U.S., I'll say, kids, people going to med school. Their home base is in the States at some point, like the administration home base for the schools. But yeah, there was a lot of us in the Caribbean doing the medical school thing. And I think it's just kind of some of the timing too, where we applied, that they're like I said, there's not a lot of spots, but a lot of us.
And do those schools have partnerships with schools in the U.S. so you can come and rotate here for a couple of months?
Yes. So I ended up doing some rotations. A little bit more difficult. It kind of goes back to the challenge part, where, we had to not necessarily set up your own rotations, but I did have to work a little bit at getting some certain rotations set up on my own. So I had to find a physician who was willing to sponsor me or take me on for that rotation.
Oh, okay.
But the part that's U.S. based, they did have the I would say the core clinical stuff set up for you, but if there was a specific elective, but you did have to potentially bounce around to different sites. So I spent a little bit of time in Atlanta at Emory and some other outside rotations, spent some time in Michigan at some of the major hospitals in Michigan, but then just had some kind of smaller town rotations that were maybe off the grid.
Yeah. Wonderful. Yeah. Wonderful. Thank you for sharing all that. Last question for you, Laurie. If you have to relive your life, would you become an oncologist?
Yeah, I still would in a heartbeat. That's not a question for me. Yeah. I love what I do. There are days that, I'll be honest, there are things that I will go, this day just sucks. And I think everybody has those days. There are days that you sometimes feel like someone is working against every moral fiber of your being. I had one of those a couple weeks ago. And you just kind of have to, I got mad, sad, probably shed some tears over it. But then at the same time, I said, you know what? I'm doing this because I love it. I do love what I do for the patients. I care for them. I want the best for them, even if the situation is absolutely not the best situation. So yeah, despite whatever downtrodden things have been happening and upsets, I would do it in a heartbeat.
Wonderful. Thank you. Thank you so much, Dr. Amaral. So the 3 key takeaways for our audiences and listeners from today's show. Number 1, when managing work-life balance or managing a family along with being a working parent, there is no perfect plan. It may look perfect from outside, but it is not looking perfect from inside to the person who is managing it or doing it. It does take a village, so please form those partnerships to have a plan B, C, and D ready for yourself and your family. Second, see if you can try and leave work at work and be present for your family and kids when you are at home. Just kind of engaging with them, be present for them, etc. I think that's very helpful advice as well, to leave work at work. And last but not the least, friendships matter. And I know it's hard when you are a working physician, oncologist, working mom. You have so many other things on your plate to juggle. And I feel like, the managing relationships or friendships comes in that little square box on the side, which is important but may not be urgent, right? And sometimes they are almost therapeutic because you can share your frustrations or disappointments and feel validated about what you feel about something at work or in your personal life, etc. So friendships do matter, even though it's a lot of work to go above and beyond to maintain them while you are a working parent. That is all for today, folks. Thank you to our viewers and listeners. This is Jasmine Kamboj and Laurie Matt Amaral signing off on behalf of OncoDaily from our conversation today on Empowering Oncologists. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.